Nana Dankwa Akufo-Addo has assured Ghanaians that Ghana will not be left behind in the global race for COVID-19 vaccines for its citizens as the health authorities combat the menace of the dreaded coronavirus pandemic in Ghana. The president has also passionately urged Ghanaians to adhere to all COVID-19 safety protocols during the Christmas festivities. President Akufo-Addo gave the assurance and made the appeal during his 20th national address and update on the COVID-19 pandemic situation in Ghana on Sunday. He disclosed that Ghana's active case count has now dropped from over 1,000 just above 900.
Indeed, the total number of active cases has reduced marginally from 1,139 as of Friday, 6th November, to 946 as of Friday, 18th December. Our hospitalization rates continue to be very low, and our treatment centers are virtually empty. As per data from the Ghana Health Service, some regions at the moment have no recorded active cases, and long may this continue. So on behalf of government, I want to thank our fellow Ghanaians who continue to adhere to the social distancing, hand washing, hand hygiene, and mask wearing protocols which serve us well. Our heroic health workers have seen to 52,675 recoveries, for which the country is extremely grateful. Unfortunately, 13 more deaths from COVID-19 and its complications have been recorded, bringing the total number of fatalities to 333 out of the 53,954 confirmed cases. May their souls rest in peace.
The president used the occasion to assure the Ghanaian public that it will facilitate the rollout of a COVID-19 vaccine program in due course, which will prioritize the safety of citizens and the efficacy of any newly developed vaccine.
Ghana, I assure you, is not going to be left behind in having access to the vaccines. I'm aware of the anxieties relating to the safety and efficacy of newly developed vaccines. Government will ensure that the COVID-19 vaccines to be deployed in the country are effective and are safe. To this end, I've put together a team of experts from the relevant institutions and agencies who are working assiduously towards the procurement and deployment of the vaccines in Ghana. The briefings held by the Ministry of Information will keep the nation updated on this matter.
President Akufo-Addo entreated the general public, especially event organizers, to keep ensuring adherence to the containment measures while cautioning citizens with underlying ailments to exercise care, especially during this festive season. President Akufo-Addo said sea and land borders remain closed as it is for beaches, nightclubs and cinemas. The non-state actors for Health and Development Ghana on Wednesday called on the Ministry of Health to ensure it restocks the country's regional medical stores and health facilities with antiretroviral drugs which has currently run out. They further urged the Ministry of Finance to urgently release clearance for antiretroviral drugs that had been stocked at Ghana's ports for some time now. According to the actors, the country was currently facing shortages of antiretrovirals across various regions, especially in Ashanti and Eastern, creating serious situations where clients involving persons living with HIV have been turned away by health facilities due to the shortages and non-availability of these medications. Ms. Juliana Na, the Eastern Regional Correspondent for NAP Plus, said follow-up to some regional health facilities, including the St. Joseph Catholic, Etia Government, in Koko, St. Martin, and Sawom Government and New Ibrahim hospitals respectively confirmed situations of total stockouts. She said other places reported of limited supplies, where a bottle of antiretroviral was shared among 3 clients and others were given 2 weeks or 10 days to return for further medications.
As we are all aware that we talk on evidence base, so we went to some of the facilities and they are as follows. regional hospital, clients are being given a supply of 1 month. At initial stage, as at last week, the drug was even rationed. 3 clients is to 1 bottle. When they open a bottle, they share it among 3 clients. That's 10 days for the clients. Just this Monday, we visited again, and I learned it has been increased to 1 month. St. Joseph, the same. Now clients are being given 1 month supply, and some are even given 2 weeks to go and come back. Atua, 1 month supply, and even clients who are on alluvia for the past 8 weeks now, they've not taken any medication. Those who are not allergic to Septrin are being given Septrin to manage it. And let's ask, what of those who are allergic to Septrin, what are they depending on?
Ms. Priscilla Adu, the representative of the Young Health Advocates Ghana, said the issue shortages, if not resolved, could spell doom for the over 21,000 young people living with HIV and deflate the population of active youth who were working towards the country's development.
Reason why we are still alive, that lifesaver, the ARVs, are not available. This spells doom, especially for young people living with HIV. Because if we want to eliminate HIV in Ghana, we cannot risk having shortages like these to the extent where 3 people are sharing a bottle. It's scary and it's frightening because young people are working, they are in their diversities. You can't give them 10 days medication and expect them to go and come back again. That's like dreaming. It's wishful thinking. It won't happen. He won't come back. She won't come back. Because they have other responsibilities to attend to. And when they don't get the medication, the effects or the consequences it's not felt at that moment. It's a gradual process to death. A gradual process of losing young people. So I am speaking to all the stakeholders that are involved. Someone is sleeping on our lives. It is not fair that we have to face this.
Madam Jacqueline Commodore, who is the advocacy officer for non-state actors, said antiretrovirals have been a major lifesaver for people living with HIV, and their shortage could lead to lapses in the treatment regime, leading to drug resistance and other severe complications that could adversely erode all the gains made towards achieving the 90-90-90 target.
How long will that sustain us? That is the key highlight while we are here today. There are other reasons why there are shortages.